So now our next speaker, we have, if we go all the way around the globe to the other side, we have Alessandra Estrela-Lima, who is from Brazil. Alessandra is, as I said this morning, she has been working with us at DogRisk for 6 months this year and last year. And we were really sad to see her go back home again. But the good thing is that she is the supervisor of Robin's PhD still. So we will have lots to do with her still. She's a veterinarian and has a PhD in veterinary pathology, and her special area is mammary cancers in dogs. And after being kind of introduced to DogRisk, also now has a very, or maybe even before, has a big interest in diet and how it affects mammary cancer. But she will talk about another aspect of diet today, which is obesity and breast cancer in dogs, and also kind of taking some steps over to compare it to the human side. So please, Ale, welcome to our session here in Helsinki, and wish you were here.
Thank you, Anna. Hello, everybody. Good afternoon. First of all, I would like to say for me, it's a pleasure to participate in the DogRisk seminar. So I am very grateful to Anna and DogRisk team for their invitation and usual kindness. Today, I talk about obesity and breast cancer, the dog as a model for translational research in humans. This is an interesting topic because they form study in different researchers, and especially around the world. So, hello, everybody. Good afternoon. First of all, I would say for me, it's a pleasure to participate in the DogRisk seminar. So I am very grateful to Anna and DogRisk team for their invitation and usual kindness. Today, I talk about obesity and breast cancer, the dog as a model for translational research on humans. And this topic is a very interesting topic for researchers from different specialties around the world. Although the significant progress in cancer researchers in recent decades, the breast cancer is still the most common tumor diagnosed in women around the world. In 2020, the incidence was 2.3 million new cases. It's about 12% of cancer cases. 685 deaths per year. The most common histological type, the mammary cancer, is invasive carcinoma of no special type. In the past, classified was invasive ductal carcinoma. Unfortunately, survival rate in the cases of metastatic cancer is less than 5 years. In the dog, mammary cancer is the tumor more frequently, 3 times than women. Malignant tumors are predominant. Carcinoma and mixed tumor nowadays is most common histological type. There is no breed predisposition, and age group of 7 to 12 years is more affected. 32% the dogs in stage 3, I mean dog have tumor more 5 centimeters, died until 1 year after mastectomy. Okay. The breast cancer is hormone tumor dependent with multifactorial etiology, with participated genetic, epigenetic, nutritional, environmental, inflammatory, mainly hormonal. Estrogen, progesterone, prolactin, androgen, even thyroid hormone contribute in the breast carcinogenesis by mechanism not yet fully elucidated. But the estrogen has a special role in the process. It can improve the process by several ways. Estrogen can increase cell proliferation, reduce DNA damage repair, oxidate distress, and generate free radicals. Together, these factors contribute for DNA damage and consequently tumorigenesis. Mice, rats, cats, dogs have been used as a model for study the breast cancer in women. And model experimental is often used, but mice don't develop mammary tumors spontaneously. Then, genetically engineered is often used. On the other hand, the dog has spontaneous mammary tumors, high incidence, environment has human intact immune system, more than 80% genetic similarities. Because of this, the dog has considered a good model for study the breast cancer in women. The human and the dog with mammary cancer has sharing similarities, characteristics, and clinical, biological, genetical, and epidemiological, such as histological type, hypervalence, pathophysiology, age of onset, clinical behavior, molecular pathways, biological behavior, metastatic pattern, prognostic and predictive factors, mutations in important genes, and the risk factors. In the women, risk factors classify in no modify and modify. The obesity is one risk factor can control. Some disease factors is in female dogs, such as age, sex, hormone, environment, contaminants, and obesity. Prevent factors include sterilized, friendly touch, balanced diet, physical activity, awareness campaign. Our group have been the awareness campaign for prevent, treatment, diagnose the mammary cancer in pets since 2014. It's an amazing moment because vets, professors, students, and society in general together for health, for pets' health. During the campaign, we teach dogs owners how to do friendly touch. And dogs can't do self-examination. Then you need help then. The simple action represents sometimes early detection, success of treatment, and good prognosis. However, the method considered most effective to prevent mammary cancer is spaying, because in the spay, reduce the estrogen level. But the question, what's the best moment to spay my dog? It's important to consider same aspect because nowadays there is no consensus about it. This aspect, it's important to consider purpose, the spaying, control or prevent. breed particularities. Sometimes spay is not indicated, but principally a relationship between early spaying and obesity, because obesity is an important factor in breast cancer in both women and female dogs. Obesity is a public health problem characterized for excessive adipose tissue, reduced expectancy in quality of life, and greater chance of developing comorbidities. In humans, approximately 1/3 of population is classified as overweight or obese. It means 2.6 billion. Obesity, in dogs, obesity, the most common nutritional disease and high prevalence and high increase in recent decades. For example, in Brazil, the dog's overweight rate is around 26%. Predisponent factors included non-nutritional management, sedentary, genetic predisposition, neutering, age, and the obesity etiology is diverse, but modern lifestyle contributes in the process a lot. Modern lifestyle contribute to increase obesity and population exposure to some potential carcinogenic habits. Of course, the human interference in the feeding routine of pets puts them at the same risk. The obese dogs share similar characteristics with human obese. Thus, they can use it as a model for studying obesity and the specific comorbidities related to obesity, such as cardiovascular disease, orthopedic disease, and same neoplasms. Is there a connection between obesity and breast cancer? Based on the same study, my answer is yes. Increased overweight and obesity has been indicated with more important risk and prognostic factor associated breast cancer in women, in postmenopause women. In the women in premenopause, the main site of synthesis of estrogen is ovarian. In postmenopause is adipose tissue. Adipose tissue can produce aromatase. Aromatase is an enzyme convert androstenedione in strong, high estrogen synthesis. Therefore, in women obese, the conversion is increased, then more estrogen synthesis. Moreover, the obesity being associated with the metabolic syndrome, then increase levels of insulin and insulin growth factors, both increase the cell proliferation and angiogenesis. I mean new bases for nutrition, for tumoral nutrition. Moreover, adipose tissue can produce adipokines. Adipokines, adiponectin, leptin, resistin, but altered adipokine. These adipokine influence aromatase activity, consequently estrogen. And cytokines result in low-grade chronic inflammation and pro-inflammatory profile represented macrophage M1. But that's happened the same in dogs. Our group recently studied the cellular concentration of androstenedione strand and expression aromatase and profile inflammatory in dogs with mammary carcinoma in their correlation with tumor aggressiveness. The dogs was classified based on condition, body condition, and histological type. Interesting results, because we check the conversion under Stenedione strong occur in adipose tissue by aromatase and directly related body fat. Decrease under Stenedione level when increase body fat. The inverse is true for estrona. So in women and dog obese, this conversion occur and the level of estrone is higher in dog obese. Aromatase activity is high in the group of overweight and obese dogs. Look, the adipose tissue in normal expression, aromatase expression, and aromatase expression in adipose tissue with obese dogs. The same results for estrogen receptor in adipose tissue, and the obese dogs have aggressiveness tumors represented by high cell proliferation, and analysis the profile inflammatory show stood out macrophage in overweight or obese group. Other study carried out by our group study levels of resistance and its correlation with aggressiveness and survival. Dogs obese, independently with or without tumor, show increased resistance, but in the group of tumors in obese dogs, the resistance level is highest, and correlation and body fat and proliferation rate represent for short survival and proliferation and aggressiveness tumors. In this way, the connection between obesity and breast cancer are present in both human and female dogs. In addition to these factors already mentioned, gut dysbiosis, that is microbial imbalance between beneficial and potential pathogenic bacteria, has been consistently associated with obesity and breast cancer. Gut microbiota is a dynamic collection of bacteria, viruses, fungi, and protozoa, also known as foregut organ. Gut microbes can modulate a variety of mechanisms and systemic functions related to health and disease. In this side, the factors can regulate the gut microbiota. In the other side, the effects of microbiota on systemic function, for example, immune cell and metabolic homeostasis or nutrition absorption. What is the role of the dysbiosis in obesity and breast cancer? In obesity, gut microbiota is involved in the obesity by direct interaction with proximal organs or indirect interaction by distant organs. The action by metabolic products, mainly short-chain fat acids. In general, non-digestible diet fibers consumed by hosts are fermented by microbiota goods and produces short-chain fat acids, acetate, propionate, butyrate, directly. And the short-chain fat acids can directly signal to adipose tissue, modulated adipogenesis, adipokine, lipolysis, and inflammation. And short-chain fatty acid can indirectly impact adipose tissue via control gut hormone, regulated satiety and food intake via brain, serotonin also, and liver by lipid accumulation and glucose production. In the relation between breast cancer and microbiota is one more complex, because it's important consider, in addition the good microbiota, mammary microbiota, local microbiota, and the effects the mammary microbiota in breast cancer interfere with cellular pathways, cell growth, apoptosis, and induces DNA damage and modulated the immune system and release bacterial metabolites. In relation gut microbiota in the prognosis of breast cancer, through the modulation immunity system, release bacterial metabolites, but mainly it's important because of the modulation of estrogen's level, strobolome. What it means strobolome? Strobolome is a sum total, the bacteria chain is relation a good control the estrogen. Estrogen and its metabolites are conjugated in the liver. The liver to allow biliary excretion. But in the gut, the bacteria possessing beta-glucosidase activity can disconjugate the estrogen and estrogen free and disconjugated and put back the estrogen in circulation. Estrogen free can act and tissue specific effects, for example, breast. In addition, the level increase and by production of estrogen mimic from diet source. One study about the stroboloma occurred in dogs. The study about the relationship of tumor microbiome or bacterium and intestinal dysbiose. The same result was shown. Then, gut dysbiose contribute to breast carcinogenesis. Really possible that dysbiose promote the breast carcinogenesis, but it also prevents this process. It's possible, maybe reversal of the gut dysbiose by modulated diet, probiotic, plant diet, fibers, polyphenols, and we have anti-tumor effects, regulation of immune system, anti-inflammatory response, modulation of oncogene pathways, and reversal of the gut dysbiose toward a favorable state inhibits breast cancer. In conclusion, dog is a good model for the comparative and translational study of breast cancer in human. There is a strong connection between obesity, microbiota, and breast cancer. And it's the important consider modulated microbiota through diet intervention and identify metabolics that directly associated with breast cancer, can use it to identify, target, and improve gene therapy of treatments. But in these contexts, metabolomic analysis looks like it's a very interesting and complementary approach, but we'll learn more about diet and metabolic in the next lecture with Robbie Moore. So, thank you for our attention. I wish an amazing seminar for all, and for me, it's a pleasure to speak for you. Thank you so much. Kiitos. Obrigado.